So I think this morning, the focus was really around some of the medical development, focusing on what happens when someone is already sick. But really, the space is far richer when we consider the parts of the lifespan before a person is actually ill and what people can actively do to prevent or even delay as much as possible illnesses and long-term chronic diseases.
The next precision-related innovation we saw was human movement monitoring. So anonymized and aggregated cell phone data from organizations like Unicast, SafeGraph, and others showed how well communities were doing with social distancing behaviors, as well as information on things like the numbers of visits for individual points of interest, like supermarkets, gas stations, and home improvement stores. And I think this really provided a lot of great insight into human behavior that was useful for policymaking. Now, some jurisdictions took this even a step further by doing individual device tracking. Nowadays, the technology even allows indoor tracking. When that's combined with outdoor information and analytics, we can start to do things like detect areas of high traffic and dwell times to really understand higher risk. And this was done in some airports and some large businesses that had spread out campuses. And we also saw things like the work that was done in the UK to analyze sidewalk width to assess the likelihood that people actually could maintain 6 feet of physical distancing. And here is a great example of various kinds of policy information like mask wearing mandates, school closures, or business reopenings. And this is one of my favorite applications using spatial and temporal data for really precision GIS. What you're seeing is aggregated social distancing data over time, where red is an F grade for social distancing and blue is an A grade. And this is the state of California, and the layer that just came up was the date that the stay-at-home orders went into effect. So you can see below that it was all red, right? There was no social distancing required. And there was a big difference between California coastal counties. They did pretty well with the social distancing, but the inland counties didn't do quite as well, but still made a good effort. Well, something happened towards the end of April, and we started to notice crowds heading to the beaches. So why is that? So you can start to pull in other layers of information to understand. In this case, we thought about temperature and went to NOAA for some authoritative weather data. And you can build that up over time using what we call a voxel layer. So now we have, I went too far. I'm probably gonna take too much time to rebuild this one, but basically what you find, I got happy with my clicker, is that the correlation between social distancing and weather is very strong, so that when it gets warmer, people stop social distancing. So it's really a fascinating review of that. Now, I will say, despite the fact that there were stay-at-home orders, many really became concerned that this was going to get out of control. Remember back before we knew that that happened. And so there was concern about infrastructure capacity. So models started popping up like CHIME and CDC's COVID-19 surge model and other models that used social distancing data along with hospital bed utilization rates to model the healthcare system's capacity to care for their local populations. Now, our spatial statisticians added locations and spatial variability to these models so that analysts and decision makers could see which regions or even which exact hospitals were going to be more impacted, when that would happen, and for how long it was likely to last.
Many of us know the importance of healthy lifestyles linked to nutrition, linked to physical activity, not smoking, having adequate sleep, or even on alcohol and salt intake. But I think the real question is, in many parts of the world where we possess this knowledge, how do we actually translate this gap between knowing and actually doing?
Behavior change is a real paradox. It's actually easy to change behaviors, but it's also incredibly difficult to change behaviors. I've worked in behavior change for about 15 years, and the two factors that are really critical to changing someone's behavior are the what and the why. The what is quite easy. The why is quite difficult. So, giving someone a Fitbit does not result in a behavior change or necessarily result in a behavior change, but giving them data and guidance and helping people to understand that if I do this, it's going to mean that. If I watch what I eat, and if I exercise more, and if I sleep properly, if I focus on my mental health, my stress, I could improve or reverse my chronic condition. That's the key driver for Fitbit, and the idea around a cost-benefit analysis is, I think, becoming less and less of a critical issue. A few years ago, there was a definite discussion, say, for employers looking to integrate wearables into corporate health programs. Will there be an ROI? I think it's less of a discussion now. It's more around, how to keep people motivated, how to keep people engaged. And from our point of view, it's really quite simple. For me at Fitbit, it was looking at the value of integrating a Fitbit wearable into the care of a patient who has been clinically managed by one of the diabetes clinics in Taiwan. We gave 4 clinics 25 devices each, and the doctors gave the devices out to the patients who all had type 2 diabetes. So the program was done under clinical supervision, and I think that's a really important point here. The focus was on helping people to understand the impact of nutrition, activity, and sleep on their diabetes care. And often people don't understand that. People who have a chronic condition, it's overwhelming. It can be very difficult. They don't necessarily understand that if I do this, it's going to mean that, or if I watch this, it could improve that. Over 3 months, and it was a short, sharp study, over 3 months, of the 100 people who started, 96 people finished the program. We saw an average reduction in the HbA1c across the group of 0.33%. People who were nudged to do more activity each day, so people who actually achieved 150 minutes of high intensity activity across the week over the course of the 3 months, saw a reduction of 0.66%. A number of people on the program lost weight. Some people lost up to 2 kilograms in 3 months, which is really quite significant if you think about it. 6 months on, we're still seeing people sustaining the change. So what we've done, and it was really important for me at Fitbit, it was important for the clinics, is giving people the information about their condition, giving them knowledge about what they can do to improve their health outcomes. So if I focus on more high intensity activity, if I go for a brisk walk 4 times a week, that means I could improve my outcomes as a type 2 diabetic. For me, that's hugely exciting, and really demonstrates the value of personalizing what we've been talking about. So making the solution wrap around the individual, giving them guidance around how they can improve their own health, and if they keep doing it over time, they could reverse their type 2 diabetes, and a really tremendous outcome that demonstrated for me absolutely categorically the value of sustaining behavior change over long term for a health condition that most governments really struggle with. In Singapore, the government's declared war on diabetes, yet the rates of diabetes in the community are still going up every year. That's the really exciting thing about integrating wearables into healthcare under clinical supervision to help people really understand and focus on how to change their behaviors over a longer period of time.
How do we provide the right incentive to reward people, to recognize people, that right pat on the back for the right kind of behaviors, particularly in health promoting, health-seeking behaviors? In your opinion, Hui Ping, first, what do you think are the key factors for nudges to remain effective for the long term?
Thanks, YY, for the question. I think a couple of considerations. First of all, it is the way that the nudges are delivered. If we're talking about digital means, whether or not and the frequency of nudging, and how long should we be nudging the same message, and based on and also based on their responses to the nudges, then we decide on how frequently we should nudge. And so these are the few things, these are the few ways I think we can try and sustain the nudging, because the worst thing to do is to nudge someone who persistently do not respond to the nudges, and then you keep sending the same nudges over a long period of time. The same way we turn off our ears when we stand on the MRT platform hearing the same reminders a couple of times every minute. I think after a while you just shut off your ears and you stop listening. At the moment, I don't think we are at the stage where we are customizing our nudges in different languages. However, what we are attempting to do is based on, for example, the 5 seasons of National Steps Challenge data that we've collected. We are trying to create tribes or clusters of participants based on their behavioral types. And if we're able to create those tribes, then we could at least customize our nudge messages according to each tribe. So not at the personal level, but at the tribe level. So that's number one. And then the second thing we're trying to do is we're also trying to look across data coming across different programs and trying to see individual preferences. So for example, if I have a participant who is physically not so active, but from our Eat, Drink and Shop Healthy program, we see that this person regularly purchases healthy choice food options of a specific type. Then we could customize our nudges to say, for example, NTUC has a discount at the moment until when for this particular food type. So this would be more personalized, and it would be something that the users would find more useful, and it can also encourage and continue and sustain that behavior. And I think I'll come back to the earlier question about incentives, but because I think there are some useful points that we can mention. So first of all, from our data, we observed that there is a substantial percentage of our participants who actually do not redeem their points. So they may be accumulating points, but eventually they don't convert them into cash incentives like vouchers. So if we continue to study these sets of data, we might be able to reach an incentive mechanism which will be long-term sustainable. And the second way is looking at incentives not just as a cash payout, but perhaps to give out incentives in the form of vouchers that can only be used to redeem healthier food choices instead of using vouchers to buy anything unhealthy or healthy. So in that sense, even if we do pay out, that would implicitly lead or explicitly lead to healthier behaviors.
It is not simply just the act of paying, it is how the incentives can be used as part of the journey for the consumers, for the participant, such that they themselves see that, in fact, when I share this data, it helps my own health be improved.